What's up, fam? Welcome back to the channel. My name is Phil Sarpon. This is Phil's Guide to PsyD. This channel is dedicated to all things psychology, wellness, and graduate school. Today, I'm going to be answering the question about what exactly do psychologists do? Now, in previous videos, I've talked about how psychologists can do therapy, they can do psychological assessment. In fact, psychological assessment is really probably the biggest thing that separates psychologists from psychiatrists or therapists and things like that. And even in some circumstances, psychologists can also prescribe medication. But here's the thing, and this is the question you guys have been asking me, is what does a day-to-day actually really look like for a psychologist? Like what's the nitty-gritty? What can I expect? What can I look forward to? Like, what does psychology look like from the perspective of a psychologist? And if you are looking into PsyD programs or PhD programs for clinical psychology, that's definitely a huge question, because you definitely want to have a little bit of an idea of what you're doing. And so for some of you, I have been talking about my practicum, I've been talking about my neuropsychology sites and some of the things that I do on a day-to-day basis with the neuropsychologists and other psychologists in the private practice. And so I thought I would do a video where I highlight some of the specifics of what psychologists actually do in this video. All right, so if you're ready for that, get buckled in, let's get into it. Okay, so there are essentially three ways to kind of think about what psychologists do on a day-to-day basis. This could be separated in terms of intervention, assessment, and support, okay? Now, along with this is, of course, all the different types of therapy and education and teaching and research. There's all of those different things, but these are a little bit more specific in terms of what it might look like if you are wanting to be a psychologist and what your day is actually going to look like on a day-to-day basis. So let's start with the first thing, which is going to be intervention. So the intervention is, whoever gets referred to you, they're going to be asking you a question. Hey, can you help me with this problem? And so for psychologists, one of the things that they will do initially is do an intake interview. Now, what the intake interview is, and it's basically what it sounds like, is that the psychologist is going to grab a ton of information about the client or the patient. So they're going to get things like their family history, their social history, their medical history. They're basically interviewing them in terms of getting all of that background information, because all of that background information is going to be needed in terms of diagnosing or treatment planning, or basically helping this person with whatever thing that they need at that moment. All right, so you have to get all that background information. So on a day-to-day basis, if a client is coming into a practice or into a hospital setting and they're about to see a psychologist, one of the first things that they're going to do with that patient is grab all their information and do an intake interview. Now, the next thing that they can do is that we've talked about this, is that they can actually do therapy, right? They can actually do individual, family, couples, or group therapy. The other thing is that a lot of psychologists are going to work as consultants just naturally, because whether there's other different professions that are asking them about different treatment planning or cases, there's always going to be questions that that psychologist is going to be asked in terms of what to do about someone's mental health. Now, the other thing too is that with COVID and everything that's been happening, there's a lot of different types of intervention that can happen. There's telephone-based intervention, there's video intervention, there's in-person intervention, right? There's all of these different things and different methods in terms of how psychologists can actually go about their treatment planning. Now, the next thing that we're going to talk about is assessment, and this is probably the thing that you guys have heard the most about what psychologists will do, right? So what exactly is assessment? So there's a lot of different types of assessment. There's psychodiagnostic assessment, there's neuropsychological assessment, there's providing feedback to clients, and also, again, telephone-based assessments. So let's start with the psychodiagnostic assessment. So this is anything that has to do with assessing someone's mental health, right? In terms of diagnosing them with a certain mental health condition, or even basically figuring out where they're coming from in their mental health and trying to intervene in some way to help them with the intervention that we talked about, whether it's the therapy or whether it's the referral to another psychologist, whatever it is. But the assessment is basically doing the actual testing that goes on, or even basically the assessment is trying to answer the question, right? Whatever question that the patient or the client has, the assessment is there, the testing is there to try and answer that question and answer that information. So next would be neuropsychological assessment, which is similar to the psychodiagnostic assessment, but that's a little bit more specific in terms of what's going on in the brain, whether it's neurological, what's happening, right? So this is what a lot of neuropsychologists will do in their practice and things like that, is that they will go through neuropsychological assessment to figure out what's going on in the brain. The next thing is providing feedback to clients. And so after someone takes a psychological test or goes through some type of diagnostic assessment, the therapist or the psychologist is always going to want to meet up with that client, whether it's through the phone or in person, and explain those test results to that person. So providing feedback is a huge thing that psychologists will do for their patients, because they want to make sure that the information is clear. They want to make sure that the patient has basically an idea of what to do next about the information. So if someone comes in, they're not really sure if they have ADHD or if they have some type of other neurological thing that's preventing them from doing well in school, for example, there's going to be a lot of neuropsychological testing, and then after that they're going to come back in and they're going to do sort of a feedback session with that neuropsychologist or that psychologist, and that psychologist is going to explain to them all the details and all the results that happen in that test, what they did, and sort of the report writing that they're going to do for that patient. And then the last thing is the telephone-based assessment, which is something that we've already kind of talked about, where there's a lot of different ways that psychologists now can really do some of this assessment, whether it's on video or phone. There's a lot of psychologists that actually do their feedback on phone now. And so a lot of different ways to do intervention, and there's a lot of different ways to do assessment, but the whole process is to answer the question, answer whatever question the patient has. And so after a psychologist or a neuropsychologist does this assessment, they've provided feedback to their clients, they might basically take them through some of the report writing that they've done for the client. So they might write some extra accommodations for someone that's looking to do well in school and they're just having a hard time. So maybe they need some extra accommodations in terms of testing. When they take their test, they need a little bit more time in school to take their test. And so they might go to a psychologist who would assess them and figure out what's going on, and then do the assessment, do the feedback, and then write a report to that school that the person can then give to the school that says, hey, I have this going on. Can I get some extra accommodations for when I take tests, right? So that's just a small example of something that could happen all the way starting in the intake interview, and then going in terms of whether it's therapy or psychological or neuropsychological assessment, and then finally going into the feedback, and then finally going into the report writing that psychologists or neuropsychologists might do. And so the other thing that psychologists will do is the support aspect. So they might do clinical writing, psychological scoring, report writing, reading, research, preparation, seminars, and didactics. And so this goes along with the report writing that I was talking about, where in order for a psychologist to write a report, they have to be able to interpret the results of the test that they give to someone. So they have to be able to interpret the results, analyze the data, and then do the report writing. So this is where that all kind of comes into play, is the intervention, the assessment, and the support piece. When you put those three pieces together, and I haven't even really talked about psychologists that will actually even give supervision to other psychologists that are in training as well, but when you put all of these pieces together, I think you get a little bit of a better picture of what psychologists actually do on a day-to-day basis. If you guys have any more questions on what exactly it looks like in terms of the day-to-day aspect of being a psychologist, definitely put it down in the comments section below. I am looking forward to just telling you guys even more information about this practice, even as I go further and further into graduate school. But if you have any comments or even questions, definitely put them down in the comment section below. If you have not already, definitely like and subscribe to this channel. Hit the bell for notifications. Anytime I post a video, you're gonna get a notification. With that, that is all, guys. Hope you guys are having a great week. I will see you guys in the next video.